Welcome. Today we're diving into the fascinating world of pathogen transmission. Pathogens are tiny organisms, like bacteria, viruses, and fungi that can cause diseases. But how do these invisible invaders actually move from one host to another? Understanding their transmission methods is crucial for preventing illness and keeping ourselves and our communities healthy. In this video, we'll explore the main ways pathogens travel, from direct contact to airborne routes and everything in between. Let's start by looking at why knowing about transmission is so important in our daily lives. Before we get into transmission, let's clarify what pathogens are. Pathogens are microorganisms that can cause disease in humans, animals, or plants. The most common types include bacteria, viruses, fungi, and parasites. Each type has its own unique characteristics and ways of spreading. For example, viruses like the flu and COVID-19 are well known for their rapid transmission, while bacteria can cause infections like strep throat or tuberculosis. Understanding the nature of these pathogens helps us recognize how they might be transmitted and what precautions we should take. One of the most straightforward ways pathogens spread is through direct contact. This means the pathogen moves from an infected person or animal directly to another individual. Examples include touching, hugging, kissing, or even a simple handshake. Skin infections, the common cold, and some sexually transmitted diseases are often spread this way. Direct contact transmission highlights the importance of personal hygiene, like frequent hand washing and avoiding close contact when someone is sick. Let's see how this method plays out in everyday situations. Pathogens don't always need direct person-to-person contact to spread. Indirect contact transmission happens when pathogens are transferred via objects or surfaces known as fomites. Think about doorknobs, elevator buttons, or shared utensils. If an infected person touches a surface and then someone else touches the same spot and then their face, the pathogen can enter their body. This is why regular cleaning of frequently touched surfaces and not sharing personal items are important steps in preventing disease. Droplet transmission is a common way for respiratory illnesses to spread. When someone coughs, sneezes, or even talks, tiny droplets containing pathogens are expelled into the air. If these droplets land on another person's mouth, nose, or eyes, infection can occur. Diseases like the flu, common cold, and COVID-19 often spread this way. Wearing masks covering your mouth when coughing and maintaining distance in crowded places are effective ways to reduce droplet transmission. Pathogens are even more sneaky. They can travel through the air over longer distances. Airborne transmission occurs when tiny particles, smaller than droplets, remain suspended in the air for extended periods. Diseases like tuberculosis, measles, and chickenpox can spread this way. Good ventilation, air filtration, and wearing appropriate masks in high-risk areas are important strategies to minimize airborne transmission. Let's explore how these tiny particles can linger and why they're so challenging to control. Fecal oral transmission is another important route, especially for gastrointestinal diseases. Pathogens in fecal matter can contaminate food, water, or hands and then enter another person's mouth. This is common in areas with poor sanitation or hygiene practices. Diseases like norovirus, hepatitis A, and cholera are often spread this way. Proper hand washing, safe food handling, and clean water supplies are crucial defenses against fecal oral transmission. Some pathogens hitch a ride on insects or animals, known as vectors. Mosquitoes, ticks, and fleas are common vectors that can transmit diseases like malaria, dengue fever, and Lyme disease. These vectors pick up pathogens from one host and transfer them to another through bites. Preventing vector-borne transmission involves using insect repellent, wearing protective clothing, and controlling vector populations in the environment. Bloodborne transmission occurs when pathogens are spread through contact with infected blood. This can happen via needle sharing, blood transfusions, or open wounds. Diseases like HIV, hepatitis B, and hepatitis C are commonly transmitted this way. Using sterile equipment, safe medical practices, and avoiding sharing needles are essential steps to prevent bloodborne infections. Some pathogens can be transmitted from mother to child during pregnancy, childbirth, or breastfeeding. This is known as vertical transmission. Examples include HIV, hepatitis B, and certain bacterial infections. Prenatal care, safe delivery practices, and appropriate medical interventions can greatly reduce the risk of mother-to-child transmission. Sexual transmission involves the spread of pathogens through sexual contact. This includes vaginal, anal, or oral sex. Sexually transmitted infections, STIs like HIV, chlamydia, and gonorrhea are common examples. Using condoms, regular testing, and open communication with partners are effective ways to reduce the risk of sexual transmission. Foodborne transmission happens when pathogens contaminate food and are ingested. Improper handling, cooking, or storage can allow bacteria, viruses, or parasites to thrive. Common illnesses include salmonella, E. coli, and norovirus infections. Safe food preparation, proper cooking temperatures, and clean kitchen practices are key to preventing foodborne diseases. Waterborne transmission occurs when pathogens are present in contaminated water sources. Drinking, bathing, or swimming in unsafe water can lead to infections like cholera, giardiasis, and hepatitis A. Ensuring access to clean water, proper sanitation, and water treatment are essential for preventing waterborne diseases. Zoonotic transmission refers to diseases that jump from animals to humans. Many emerging infectious diseases like COVID-19, Ebola, and rabies have zoonotic origins. Close contact with animals, consumption of animal products, or exposure to animal waste can facilitate this type of transmission. Practicing good hygiene around animals and monitoring animal health are important preventive measures. Nosocomial or hospital-acquired infections occur in healthcare settings. Patients, healthcare workers, and visitors can all be at risk. Pathogens can spread through contaminated equipment, surfaces, or even the air. Strict hygiene protocols, sterilization, and infection control measures are necessary to prevent nosocomial transmission and protect vulnerable patients. Vomites are objects or materials that can carry pathogens such as towels, bedding, or medical instruments. When these items become contaminated, they can transfer pathogens to anyone who touches them. Regular cleaning and disinfection, especially in shared spaces, are essential to minimize vomit transmission. Oral transmission occurs when pathogens enter the body through the mouth, often via contaminated hands, food, or water. This route is common for gastrointestinal infections. Practicing good hand hygiene, safe food handling, and drinking clean water are effective ways to prevent oral transmission. Respiratory transmission involves the spread of pathogens through the air, typically via droplets or aerosols. Coughing, sneezing, or even talking can release infectious particles. Respiratory illnesses like influenza and COVID-19 are commonly spread this way. Wearing masks, good ventilation, and covering coughs are important preventive measures. Parenteral transmission refers to pathogens entering the body through injections, cuts, or punctures. This can happen during medical procedures, needle sharing, or accidental injuries. Using sterile equipment and following safe injection practices are crucial to prevent parenteral transmission. Autoinoculation occurs when a person spreads pathogens from one part of their body to another. For example, touching a cold sore and then touching the eye can transfer the virus. Good personal hygiene and avoiding touching infected areas help prevent autoinoculation. Iatrogenic transmission refers to infections caused by medical procedures or treatments. This can happen if instruments aren't properly sterilized or if there's a lapse in infection control. Healthcare providers must follow strict protocols to prevent iatrogenic transmission and protect patients. Transplacental transmission occurs when pathogens cross the placenta from mother to fetus during pregnancy. Some viruses like rubella and cytomegalovirus can cause serious complications. Prenatal screening and medical care are important to detect and manage these risks. Transfusion transmission happens when infected blood or blood products are given to a patient. Strict screening and testing of blood donations are essential to prevent this type of transmission. Modern blood banks have rigorous protocols to ensure safety. Transplant transmission occurs when organs or tissues from an infected donor are transplanted into a recipient. Careful screening and testing of donors help minimize this risk. Advances in medical technology have greatly improved transplant safety. Transdermal transmission involves pathogens entering the body through the skin, often via cuts, abrasions, or insect bites. Wearing protective clothing and using insect repellent can help reduce the risk, especially in areas with high vector-borne disease rates. Transovarial transmission is a special case where pathogens are passed from parent insects to their offspring through eggs. This method is important in the life cycle of some vector-borne diseases, ensuring the pathogen persists in the environment. Mechanical transmission occurs when a pathogen is physically carried from one place to another by a vector, without multiplying inside the vector. For example, flies landing on food after touching waste can transfer bacteria. Keeping food covered and maintaining cleanliness are effective preventive measures. Biological transmission involves a pathogen multiplying or developing inside a vector before being transmitted to a new host. Mosquitoes spreading malaria are a classic example. Controlling vector populations and using protective measures are key to prevention. Environmental transmission happens when pathogens persist in the environment, such as in soil, water, or surfaces, and infect new hosts over time. Tetanus bacteria in soil is a good example. Proper sanitation and environmental management are crucial for prevention. Person-to-person transmission is a broad term covering direct and indirect contact, droplet, and airborne routes. It's the most common way many infectious diseases spread. Practicing good hygiene, vaccination, and staying home when sick are effective ways to reduce person-to-person transmission. Animal-to-human transmission, or zoonosis, is when diseases are transferred from animals to people. This can happen through bites, scratches, or contact with animal products. Rabies and avian flu are examples. Avoiding contact with wild animals and vaccinating pets are important preventive steps. Humans can also transmit pathogens to animals, a process called reverse zoonosis. This can affect pets, livestock, and wildlife. Practicing good hygiene and limiting contact when sick helps protect animals from human-borne diseases. Community transmission refers to the spread of pathogens within a community, often with no clear source of infection. This can make outbreaks harder to control. Public health measures like social distancing, mask wearing, and vaccination are crucial in limiting community transmission. Household transmission happens when pathogens spread among family members or people living together. Close contact, shared spaces, and common items increase the risk. Isolating sick individuals and maintaining cleanliness can help prevent household transmission. Schools are environments where pathogens can spread quickly due to close contact and shared facilities. Teaching good hygiene, regular cleaning, and encouraging sick students to stay home are effective ways to reduce school transmission. Workplaces can also be hotspots for pathogen transmission, especially in crowded offices or shared workspaces. Promoting hand hygiene, regular cleaning, and flexible sick leave policies help reduce workplace transmission and keep employees healthy. Travel, especially international travel, can facilitate the rapid spread of pathogens across regions and countries. Airports, airplanes, and crowded transportation hubs are high-risk areas. Following travel advisories, vaccinations, and hygiene practices are important for safe travel. Large events such as concerts, festivals, or sporting events can accelerate the spread of pathogens due to close contact among many people. Event organizers and attendees should follow public health guidelines to minimize the risk of transmission. Some pathogens spread more easily during certain seasons. For example, flu viruses are more common in winter while mosquito-borne diseases peak in warmer months. Understanding seasonal patterns helps us prepare and take preventive measures at the right times. Some people can carry and spread pathogens without showing any symptoms. This is called asymptomatic transmission. It makes controlling outbreaks more challenging as people may unknowingly infect others. Regular testing and preventive measures are important even if you feel healthy. Superspreader events occur when a single individual infects a large number of people, often in crowded settings. These events can rapidly accelerate outbreaks. Identifying and managing superspreader events is a key part of public health response. Now that we've covered the many ways pathogens can spread, let's focus on prevention. Good hygiene, vaccination, safe food and water, vector control, and public health measures all play vital roles. By understanding transmission methods, we can make informed choices to protect ourselves and others. Public health organizations play a crucial role in monitoring, controlling, and preventing the spread of infectious diseases. They provide guidelines, conduct surveillance, and respond to outbreaks. Community cooperation and following public health advice are essential for effective disease control. As our world changes, new challenges in pathogen transmission arise. Urbanization, climate change, and global travel all impact how diseases spread. Staying informed, adapting prevention strategies, and investing in research are crucial for meeting future challenges. We've explored the many ways pathogens can be transmitted and the importance of understanding these methods. By practicing good hygiene, following public health advice, and staying informed, we can all play a part in preventing the spread of infectious diseases. Thank you for joining us on this journey through the world of pathogen transmission. Stay healthy and safe.